Hello, everyone, and welcome to our third topic in NCUI's Project First Line training series for our frontline workers, COVID-19 and infection control. Today's topic is understanding the importance of personal protective equipment, or PPE. Does it really matter? And the question is asked in the context of the current global COVID-19 pandemic. Before we begin, please note, as always, that this session will be recorded for educational and quality improvement purposes. NCUI will be utilizing the recording to continue to share and educate the frontline healthcare workers throughout this pandemic. So thank you again for joining. We are very pleased that you could join us today, and it is our hope that this forum provides an opportunity for you to gain the knowledge and foster best practices as it relates to infection control. During each session, we will hear from our experts as well as offer opportunities for you to ask questions regarding the topics covered. My name is Melissa Watson, and I am NCUI's Project First Line Public Health Project Assistant, and I will be your host today. If you do have any IT difficulties during today's call, please chat directly to Noelle, who is under Comms and Events in the direct chat, and she can assist you. Finally, we do ask if you could please enter your name, any UIO or external organization you're with, and any tribal affiliations into the chat box so that we can get to know each other and count your attendance. Our agenda today features a brief recap of Project First Line as well as our Project First Line team. We're then going to move into our overall training on PPEs. And then after our training, we're actually going to divide into groups for 3 breakout rooms to discuss certain questions applying what we will cover today. Finally, we will wrap up as a group together to share our thoughts and for you to ask any questions. So to begin, we have a quick background on NCUI. The National Council of Urban Indian Health is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives that are living in urban areas. NCUI is the only national representative of the 41 Title V UIOs under the IHS and the IHCIA. NCUI strives to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible healthcare centers. We would also like to thank the Centers for Disease Control and Prevention for their continued support. Project First Line is a national collaborative that is led by the CDC to provide infection control and training, as well as education to our frontline healthcare workers and public health personnel. NCUI is proud to partner with Project First Line. The contents of this program do not necessarily represent the policies of the AAAHC accreditation body, OSHA, CDC, or HHS, and should not be considered an endorsement by the federal government. Next, we would like to quickly reintroduce you to our Project First Line staff here at NCUI. Dr. Kimberly Fowler is our Vice President of Technical Assistance and Research Center. Zipporah Fuller is our Director of Technical Assistance. Evelina Maho is our Public Health Program Manager. Diana Pejuan is our Senior Project Manager. Tiffany Stark, our Program Associate. Noelle Zelke is our Communication Associate. Alex Zamo is our statistician, and Karen Kwok is our subject matter expert. Next, to understand Project First Line, we will recap their overall vision. A part of Project First Line's vision includes an unprecedented infection control training collaborative for the U.S. healthcare workforce to create a culture of infection control training and education in all healthcare settings to improve the national ability to fight all infectious disease threats. So why now? We must slow or stop the spread of infectious disease threats, including COVID-19. Infection control works best when done consistently and correctly by all. To achieve that, we want to ensure that everyone in healthcare is familiar and understands the strategies to be confident to implement. As a reminder, if you haven't done so yet, please visit the CDC's website or their Facebook page to review their short video logs in the series title, Inside Infection Control. We will drop the link in the chat as well as email them to you later. There are currently 24 video blogs with a variety of topics that you can share with your staff as part of your training curriculum. The topics range from infection control, basic science of viruses, to source control and ventilation, as well as multi-dose vaccine vials and cleaning disinfection. And lastly, we would like to provide you with our post-evaluation survey link. We will be providing the link in the chat now, as well as the end of this session, which will also provide with the recording of this session, as well as all of the templates and PowerPoints we use today with the links. Please complete our survey at the end of this session and let us know how we can serve you better. Your evaluation of the training content and delivery will enable us to meet your training needs and improve the quality of our program. Next, we would like to welcome our trainer for today, Ms. Evelina Majo. She is the Public Health Project Manager in the Technical Assistance Division of the TARC Department at NCUI. Evelina has worked many years in the healthcare industry, primarily with the American Indian and Alaska Native populations. She has used community-based participatory approaches and other methodologies in her work of prevention, management of chronic health, and the promotion of health and wellness. Much of this work has involved coordination, integration, and collaboration with clinical services within each healthcare organization she has worked. I would now like to hand over our training portion to Ms. Evelina Majo.
Evie, it appears you're muted.
I'm sorry, I should have done a sound check. Can you hear me now?
Yes, you're loud and clear. Go ahead.
Thank you. Thank you, Melissa, for the introduction. In today's training, our 4 major objectives include a review of the different types of PPE, understanding what is worn, when, and by whom, and how we decide this, as well as understanding the importance of PPE during the current pandemic, along with providing an opportunity for our UIOs to discuss PPE use challenges and their sites through interactive breakout sessions. Next slide. Today, our training topic is titled Understanding the Importance of Personal Protective Equipment. Does it really matter? This is a part of our series, COVID-19 and Infection Control. Next slide. PPE, personal protection equipment, is the gear that we use to protect ourselves from exposure, as well as to reduce the spread of germs to others in the environment. Healthcare workers, firefighters, construction workers are just a few, and scientists are just a few of those that we use as an example that wear PPEs. With the COVID-19 pandemic, we all at minimum wear a face mask. Next slide. In healthcare, the individuals wearing PPE is protected from the environment, other individuals, and also protected from the wearer and each other. Remember, PPE doesn't have a brain of its own. So think through your gear. Thanks to Ashley Keone here on the slide. She's Navajo and she works at Phoenix Native Health, who's pictured, and she agreed to share her photo for our today's talk. Next slide. So the main types of PPE in healthcare, in light of the COVID-19 disease, which is caused by SARS-CoV-2 virus, the main types of PPE we see each day in healthcare are gloves, gowns, respirators, eye and face protection, and different types of masks. Next slide. The protection of our eyes, face, such as goggles or face shields, it helps to keep the respiratory droplets from entering our bodies via tear ducts. By entering here, the germs can travel down the tear duct or the lacrimal glands, and then another name for the tear duct drain that connects to our nose, throat, and mouth. So on the next slide, you'll see an illustration. Next slide, please. Without protecting your nose when providing direct care for COVID-19 positive patients, you risk from respiratory droplets that can either enter your body through the tear duct, travel down the drain, or tear duct to reach the nose, throat, and mouth. So on your slide on the left, you see the passages that begins from the tear duct, and it could travel through down in and make its way to the nasal cavity. On the right, you see the nasal cavity and the opportunity for an infection, bacteria or exposures to get down to the throat region and mouth. Next slide. When looking at gloves, the first barrier of PPE for a person is their healthy skin. Germs can, however, enter through any breaks in our skin. So it's really important we utilize our second barrier, which is the gloves. Always ensure you wash your hands prior to putting your gloves on, and especially upon removal. We do want to make note that the CDC does not recommend double gloving when providing care to COVID-19 to suspected patients. We did share a link, it's there on your slide. Please take an opportunity to read through this literature that speaks to the recommendation. So in this particular study, 35 of 67 patients were colonized with Candida auris, and I'll refer that to C. auris or auris, in a specialty COVID unit, resulting in a large outbreak. So healthcare professionals were observed in this study and to wear that wore multiple layers of PPE, gown and glove throughout their shift. While double gowning and gloving increased, the perception of more protection occurred. It is showing to be more harmful, however, and causes more lapse and cross-contamination. So multiple layers of PPE is not recommended for COVID transmission-based precautions. Other things like lapse in cleaning and disinfection of shared medical equipment and lapse in adherence to hand hygiene likely contributed to the widespread of this and the transmission. Okay, so we will share that link also, or this PowerPoint slide will be shared, so you can take an opportunity to take a look at that literature. Next slide. So the next question of should I wear gloves when I'm vaccinating patients occurs. Dr. Abigail Carlson from the CDC Project First Line team and Erica Tyndall Yumikun, a nurse practitioner with the ANA, drafted a risk assessment on how healthcare workers could decide on what situation required them to wear gloves while giving vaccines during the pandemic. Tiffany will drop that link into the chat box. And so this is the guide, and it's titled, Should I Wear Gloves When I'm Vaccinating Patients? It's, again, a risk assessment guide that we wanted to share with our participants and learners today. So here on the slides, these are instances when you might choose not to use those gloves, okay? During interactions when you won't have contact with blood, body fluids, or non-intact intact skin. If there's a possibility you won't be able to change gloves between patients during a mass vaccination campaign, or during times when unnecessary glove use might lead to or worsen shortages. Okay, next slide. We continue on by asking also ourselves, when's an appropriate time? When should I wear gloves when vaccinating patients? Here are a few more points. If you could get blood or body fluid on you, if your own skin is not intact, if your patient has non-intact skin that you need to touch, if you're providing vaccination services in a healthcare setting experiencing a COVID-19 outbreak. Next slide. So let's go ahead and pause here for our first knowledge check. So a question should have appeared on your screen asking, does the CDC recommend double gloving? We'll pause here and allow everybody to participate in this polling question.
And this is in light of the pandemic and referring mostly to COVID-19.
We have about 35 more seconds to complete the questions on the screen and give everybody an opportunity to answer that question. Okay. So some of you are viewing now the poll results. Thank you for taking that poll. 85% of the responded with no and 15% yes. The answer is no. Okay. CDC does not recommend double gloving. And again, we did share the link on the literature that speaks to that particular question. Okay. Thank you. I'm sorry, I'm trying to find my notes here. PPE grounds. We will now review gowns. We're moving into that next topic of gowns. Gowns protect our clothes and reduce the spread of germs in our environment. So there's level 1 isolation gowns. They're commonly used by most healthcare workers. The gown should fit lengthwise by not dragging it on the floor, as well as widthwise, so not to be too tight that it would restrict movement or even rip. As the same with gloves, please do not use more than one gown at the same time. So no double gowning. Next slide. Another type of PPE are respirators. So next, respirators. Next slide, please. Respirators keep you from breathing in particles from the air that can harm you, like germs, chemical dust. So there are many different types of respirators, but today we will be focusing on air purifying respirators. So these use filters, canisters, or cartridges to remove the bad particles. They do not replace the air. Filter face piece respirators, powered air purifying respirators, and half or full mask respirators are types of air purifying respirators. So filter face piece are used once with N95 being the most common. Powered air purifying use batteries to filter the air, blower to get clean air to you. And the half or full mask can be cleaned, disinfected, stored, and reused. However, they can be bulkier than others. So here in this image shows various types of respirators, and we'll be able to share that again in the chat box with you all, so you all can take a closer look at those. Next slide. So Tiffany will be sharing that link, so you can just take a look at those images a little bit more closely. Here are the differences with masks and respirators lie in what they're made of and their intended use, along with how they fit. Face seal test. So if they can be reused and what they protect against, along with others, for a closer look, again, we'll drop another link for you all as resources so you can take a closer look at this particular slide and the example used. Next slide. This is also a very helpful and useful tool for our healthcare frontline workers. So when putting on a face mask, we must clean our hands, put on our face mask so it fully covers the mouth and nose. When removing a face mask, clean your hands, remove your face mask, touching only the straps or ties. So we want to emphasize that you don't wear your face mask under your nose or the mouth. Don't allow a strap to hang down. Don't cross the strap. Don't touch or adjust your face mask without cleaning your hands before and after. Don't wear your face mask on your head. Don't wear your face mask around the neck. And then finally, don't wear your face mask around your arm. Next slide. Again, that last slide, Tiffany will be dropping a CDC link for you all where you're able to download the material and share that with the frontline workers as well, and also utilize during your training. So respirators keep you from breathing in particles from air that can harm you. And there are different types of respirators. So again, filtering face piece respirator, the powered air filtering respirator, and the half and full mask respirators. The N95 respirator is an FFR, or filtering face piece respirators. Next slide. From the National Institute for Occupational Safety and Health, testing of the N95 respirators. 95% of the germs are filtered. They block personal respiratory droplets from entering the environment. So how does this work? The filter keeps out certain size particles and droplets before they can reach the mouth, nose, and lungs. So you do not have to complete a fit testing for this respirator and ensure that the two straps are always around the head when worn. Okay, next slide. So how do we test our N95 seal? The user carries out a positive pressure check to evaluate the seal. Breathe out gently while blocking the filter to check for any leaks around the filter as well as the side of the mask. Perform this each time you use your N95. If you feel leaks, you first adjust the metal around the nose and the straps around your head, then retest. If you feel these leaks still, please replace the mask. Okay, nice. Next slide. Another link is provided to you to check the CDC website for a poster shown here that shows how to check the seal of the N95 respirator and what to do once it's removed. And Tiffany will drop that in the chat box again for you all. Next slide. Again, we will pause here for another knowledge check, and a question should appear on your screen. Fit testing is required for N95 respirators, true or false? We'll go ahead and pause here and allow everybody to answer that question. Again, the question asks that testing is required for N95 respirators. We have a few more seconds to allow participants to answer the question, true or false. Thank you. So you're able to see on your screen the results of the poll results. 88% of our participants answered true, and 12% answered false. And the answer is true. Yes, the fit testing is required for the N95 respirators. Thank you. Next slide, please. So there are some factors influence PPE selection. Now that we understand the different types of PPE, how do we know which ones to use? The types of exposure that you anticipate to be subjected to helps to determine this. So the types of exposure range from low to very high, and these are just examples. So low is minimal contact with general public. Medium is frequent contact with less than 6 feet space. High risk is entering exam rooms or being in closed vehicles, and very high would be involved performing like procedures, collecting or handling specimens or autopsies where you are in extreme close contact and could be handling fluids. You also want to consider your overall interaction, not only with the patients, but visitors and coworkers as well. So durability and appropriateness for the task at hand will also play a factor and a role, as well as the fit for the PPE. So here, Tiffany will also drop another link for you that would help determine where your facilities, your staff might fall into what category. So there's a great resource there for you. Next slide, please. This depends on the level, again, of the interaction with suspected or confirmed positive COVID-19 patient. Excuse me, if highly suspected and the level of interaction is great, then isolation gown, gloves, and N95 respirator along with goggles or face shields should be worn. When interacting with non-COVID-19 patients in a high or moderate transmission area, then a medical mask that fits well along with goggles or face shields can be worn. And At all other times, medical masks that fit well should be worn by all staff. Next slide, please. So why is this important? With COVID-19, to prevent the spread, we want to spread the respiratory secretions of an infected person coming in contact with the mucous membranes of another individual. PPE, such as face shields or goggles and masks or N95 respirators, protect our mucous membranes when worn appropriately. Next slide. Another knowledge check for you all. So let's take some time here and pause and answer a question again. The question reads, an MA, medical assistant, should wear the following PPE when providing direct care to a patient with COVID-19. So we'll go ahead and pause here and allow the participants to answer the question. We're at 76% of our participants have voted. Thank you for that. We'll allow a few more seconds to complete this. The question reads, an MA should wear the following PPE when providing direct care to patients with COVID-19. All right. So now we have here that 100% of the participants have all answered all of the above, and that is correct. Thank you for participating. I'm very thankful that we're picking up a lot of key contents from this lecture today. So next slide, please. There are certain strategies that can be employed when dealing with PPE shortages. Here we have an image from CDC in reference to supply and demand of PPE. The three levels of capacity are conventional, contingency, and crisis. For conventional, these strategies should already be in place, your day-to-day operations. Contingency can be used during periods of anticipated PPE shortages, and crisis is when supplies cannot meet the current or projected PPE utilization rate. In interest of time, we will share the link again with you in the chat so that you can spend additional time reviewing the various categories. Tiffany will drop that link for you in the chat box. Next slide, please. The next slide shows the various strategies that can be employed for PPE types for all the three situations we just discussed. So that, again, these strategies are for optimizing the supply of PPE during these shortages and or be breaking down the different levels of the capacity level. So again, in the far left column are the different types of PPE. Keep in mind when we're saying conventional, these are all protocols or procedures that you should already have in place. And then we move into the contingency region, and then in the crisis mode are some measures or strategies that we can take as an organization. We will skim through slide 38, so next slide, please. Thank you. There it goes. So again, all PPEs on the far right are the PPE types. And then in the different types of strategies are listed within the conventional domain, contingency, and crisis below that. Next slide. Provide strategies for face masks, gowns. Next slide, please. Eye protection and gloves. Okay, so these slides will be made available for you, so feel free to, we'll send those out with a thank you letter for you after our presentation so you can take a closer look at those supply and demand section. The next slide, please. So another tool that CDC provided for use in evaluating inventory and need is the burn rate calculator. We will drop you a YouTube video link in the chat that will walk you through how to use the spreadsheet, and another link that will take you to where that spreadsheet can be downloaded. So again, Tiffany will be dropping that into the chat. The personal protective equipment burn rate calculator is a spreadsheet-based model that will help healthcare facilities and plan and optimize the use of PPEs for response to coronavirus disease 2019, COVID-19. To use this calculator, you enter the number of full boxes of each type of PPE, and then the number of patients at your facility. The tool then calculates the average consumption rate, also referred as the burn rate. For each type of PPE entered in the spreadsheet, the information can then be used to estimate how long the remaining supply PPE will last. Based on the average consumption rate, using the calculator can help facilities make order projections for future needs. Okay, next slide. Briefly, the charts are automatically generated through the number of days of PPE supply remaining and the total number of boxes used per day. Data is only entered into the first spreadsheet. If you receive a new inventory, then you will need to clear that spreadsheet and begin again. Next slide. Another tool we wanted to share with you is called the NIOSH's PPE tracker app. And this tracker mobile app can help track your PPE inventory. Facilities can use the app to calculate their average PPE consumption rate or the burn rate. The app estimates how many days a PPE supply will last given the inventory based on the PPE burn rate calculator Excel spreadsheet. The app features several improvements, including an easy-to-use interface and the ability to add or restock. The app is available in the iOS and the Android devices. So I will go ahead and we also will share this link for this particular app for you all to take a look at as well. And I will go ahead and hand over the talk to Melissa at this point in time. Thank you.
Thank you, Evie. Thank you again for your time. We would also like to next actually welcome our subject matter expert, Ms. Karen Kwok, a family nurse practitioner and technical advisor. Karen has a dual master's in nursing and public health with a national certification as a family nurse practitioner. She'll be providing a brief commentary on today's training. Karen, I'll hand it off to you.
Thank you, Melissa. Can you hear me, everyone? Yes? Great. Thank you for that thorough and detailed review of the different types of PPE, the understanding of what situations require certain types of PPE depending on the staff responsibilities, and some of the challenges of PPE use through gauging the PPE burn rate calculator. And overall, all staff, no matter what their role would be, would practice universal masking and hand hygiene. But the rationale is the same for everyone, where we're trying to protect against infection as well as preventing the spread of germs to not only patients, our colleagues, but also our community members. The function of PPE depends on the role specific to the healthcare professional in their own setting, and depending on the activities that they are involved in for patient care, the level of risk exposure that they might have. So those are just some brief highlights from our presentation today, but I do want to leave plenty of time for questions and answers, as well as our breakout sessions too. So I'll hand the floor back to Dion now. Thank you.
Thank you so much, Karen. We appreciate that, and we will look forward to speaking with you in a little bit. But next, we're actually going to move right into our breakout rooms for today. So we'll be separating into 3 rooms. The topics that we have listed here will be divided and discussed by each room with one reoccurring question, which is the last one listed on the slide here. We'll break for about 15 minutes and then reconvene back into the room to discuss. You should be seeing your room assignments pop up now, so please feel free to join them.
Yes. So it looks like we're going back to the main room. Erin, will you graciously report back to the main group for us?
Yeah, certainly. So in our discussion, We got into a little bit about state-specific laws around PPE. So one of our group members in California, they were looking to purchase a cleaner for gowns and masks to decontaminate. And then OSHA came out and had some conflicting things about decontamination compared to what CDC was saying. So they were kind of always concerned about whether they could decontaminate or not. Also having some challenges figuring out which KN95s could be used or not within the clinic. And then other laws that came into play that said they needed to have enough PPE on hand to last 90 days. So that kind of integrated into their burn rate calculator and some other administrative oversight. And then specifically for Denver Indian Health and Family Services, for my clinic, we're fortunate enough to have a one-on-one call with a CDC affiliate to go over the burn rate calculator, how to use it, and really provide us some additional insights into changing your mask every day, not wearing the same one home, coming back into the clinic, utilizing the same one. So we had some things pop up in that discussion about what our processes and protocols were that we needed to update. So that was an example of one. And then something else that we're doing specifically within our dental clinic and department is that all the dental staff wear fitted N95s as well as face shields, just to kind of double up on that protection, because we feel that they're the most at risk when dealing with patients within our clinic. And as far as other PPE goes, we have staff are required to wear gowns and masks appropriately when you're dealing with patients. For myself in the administration department, I specifically just have to wear a mask. And then if I go into the clinic, I do, the clinic setting where there are patients coming in and out, putting on a gown and masks or a gown and gloves to have the adequate PPE. And, at this point, we've been doing this for months, so all of our staff is pretty familiar with all of the PPE procedures and policies that we have in place. So that's kind of an overview of what we discussed in our group.
Thank you, Erin.
Thank you, Erin. Thank you, Evie. Do we have the speaker from Dion's room that would like to give a synopsis of your group?
Surely, we were very fortunate to have Haley. So Haley took notes for us. So go ahead, Haley, if you want to provide a synopsis.
Yes.
But go ahead.
Okay, so each of the participants had different sites, and they kind of talked about, we only got through one of the questions, but each of them had really different mandates for each of them of the sites, and it really depended on if there was a surge in COVID-19 patients in the state. And it was also dependent on if there was state guidelines. It seemed like there was no clear mask mandates for each of them, so they kind of had to kind of analyze their situation and adjust to it. And then there was also a difference in the work office and if they shared space or not. And it also depended on their site. And a lot of the times the gloves and gowns were a little bit more optional unless they were speaking to a patient outside of it. And then we kind of just touched on a little bit of the issues, and one of them was allergies to the mask. And then the solution would be using cloth masks, but again, dependent on the situation. And then there was a touch about air purifiers. And I think that's about all of the sites talked about. It was very detailed.
Thank you, Haley. I appreciate that feedback.
Yes.
Tiffany's room?
Hi, this is Rochelle from Tiffany's group. I was able to take notes for the group, and mainly the comments around the first question, how is my clinic facility organization approaching the use, stemmed into a conversation about different departments being trained, getting fit tested for the N95, that they're following proper PPE policies, and then making sure that each department receives training. Another organization talked about how they approach contractors and third parties entering their space, providing a screening form in advance so that they are screened well in advance to actually enter into the building to conduct business that they need to do. Some other comments around issues at the site with PPE being worn was that it was really uncomfortable to wear the N95. And so really making sure that it was fit properly is an important piece. The organization used acknowledgement forms so that staff could document their adherence to wearing PPE. And then there was also comments about a QI team roving through the site to monitor and evaluate whether people are adhering. Some types of solutions included that walkthrough and the use of acknowledgement forms. So that's mainly what our group discussed.
Thank you so much, Rochelle, and thank you all for sharing. Karen, I know we still have a few more minutes left. Did you want to come back on to tie everything together with what you spoke about with the groups when you were able to pop in?
Yes, thank you for that moment to share. I was hoping to get to room 3 next time. Thank you, Rochelle, for sharing those points. I was able to get to rooms 1 and 2, and some takeaways that I have for all the attendees here is that with the tools that we've shared here, like the PPE burn rate calculator, that with the surge capacity and then now going into contingency capacity, how are we ensuring that we have consistent stock supply, and how are we ensuring that our budgetary needs from an administrative standpoint, like Erin was saying, is able to accommodate those fluctuations. So just some thoughts to take back to your administrative team on using the PPE burn rate calculator tool. Something that I also took away was the challenges that I believe it was Dawn in California had brought up, which was regarding how are we able to stay prepared, where from previous activities that had come up, that they were able to have sufficient supply of the mask. But I would just be curious as to lessons learned in just hearing about COVID a year ago this month, and how that messaging has changed, not just for ensuring patients are safe when they're coming in and the expectation is mutual in feeling safe coming, yet also making sure that there are their responsibilities carried out for staff safety as well. So how has that messaging been tried and evaluated and revised during this process, along with the staff being able to be prepared, not just with the PPE made available to them, but in providing the health education that they need to share with their patients. And then in room 2, I believe, or it might have been room 3, I'm sorry. I really like the idea coming away from the clinical setting and then integrating these best practices into a infection control policy and procedure, that we're looking at staff requirements and compliance with acknowledgement forms, looking at how these prepared activities within the clinical setting can be integrated within QI activities of the institution as a whole. So I was really glad to hear the best practices shared by all the different sites. I hope to make it to room 3 at another event. Thank you.
Thank you so much, Karen. And do we have any questions before we wrap out for the day from anyone? If you want to, feel free to, you can unmute or even drop into the chat box as well.
And if anyone has any questions regarding the training portion that Evie rolled out, we can take those questions now. Okay, well, you have our email address, ipc@nucui.org. If any questions pop up over the next couple of days, please feel free to email us and we'll get back to you with an answer. Go ahead, Melissa.
Thank you. So Noel, we can move on to the next slide. Again, thank you all. We just also want to have a reminder here for you that we have our post-evaluation survey. Again, Tiffany has also dropped it in the chat box for you as well. So if you could please take a few moments to provide us your feedback on the training today, as well as to help us better create trainings for you in the future. Before we do close out for the day, we do also want to note that from our training with Evie this afternoon, we wanted to show that we have reviewed the articles that were shared and all of the resources. So you will be receiving this PowerPoint along with the recording. So you'll have access to all of the links that were shared in the chat, as well as what was sourced out on the slides. And then again, we also have some more resources here for you, also noting CDC's Project First Line. Then we also just wanted to share with you some of our upcoming events here at NCUE, where our next event will be on March 30th, again at 2:30 Eastern Standard Time, and it's going to be a closer look at hand hygiene, and infection control is literally in your hands. And another reminder as well for March 18th, so this Thursday at 1 o'clock Eastern Standard Time, we have our accreditation prep and best practice for the AAHC. And the registration link again will be shared with you. And also just to please note that for everyone that is joining this, you will be receiving the materials for the AAHC accreditation. So you will be saving that from purchasing it in the future for your organization. And then lastly, we also want to share on April 20th and 1 p.m. Eastern is Weaving Calm, a strength-based approach to addressing stress among urban and Native youth during COVID-19. That session will be next. And then lastly, we have a reminder for our virtual conference from May 25th to the 27th. We have a save the date and we will be having more coming out for you as well. So we just want to say thank you for everyone. Thank you for our presenters today for sharing with us, and we hope you have a wonderful afternoon.